Hey, this is Malika of Evanston Live TV, and I have with me today a very special guest. His name is Kevin Mott. Many of you know him throughout the Evanston community. He's a financial advisor with Edward Jones, but I don't know if I should say more importantly, Kevin,
Just as important.
just as important,
Right.
he is part of the Kappa Alpha Psi fraternity, and they have a very important event coming up. It's a series that's going to answer questions in regards to what's happening in our community with COVID-19 and the vaccine. And I am really looking forward to this event because I have questions that I need answers to. So, welcome to the show, Kevin.
Thank you, Malika. Thanks for having me, and thanks for providing us with the forum for this.
Oh, yes, yes. Now, Dale has sent me the flyer for this, and he was like, "You need to talk to Mott." I guess you fraternity, y'all call each other by your last name.
Right, right. That's the best name that he could have given of the ones that people use for me. So I'll take that one.
Okay. Yes. And so I was checking it out, and then I went to look up the Paul W. Kane Foundation, and I said, okay, so actually the foundation does quite a bit. I mean, it covers scholarships, financial literacy, and now, of course, because of the urgency in the community, COVID-19 and the vaccine. So tell us more about this series that's coming up.
Okay. Well, before I go right into the series, just for anyone who may not be familiar with Kappa Alpha Psi fraternity, we are one of the fraternities the historically Black fraternities that people kind of sometimes call the Divine Nine, the D9 organizations. We were founded in 1911 at Indiana University by 10, really outstanding young men, and we've had an alumni chapter here in Evanston since 1959. So we have deep roots, deep ties to Evanston, and in addition to that, one of our founders, Paul W. Kane, actually had a business here in Evanston. It was on Asbury, where the just north of Emerson, I believe, where the funeral home is today. So one of our founders owned a catering business that was here in Evanston at the time, and that's one of the reasons why we picked his name for our foundation. So we're the philanthropic arm for the alumni chapter. Our primary goal is to just assist our community, gearing more towards young men, African American men, but really doing anything and everything we can to support the community. This past summer and fall, we were able to support some different organizations in the area that were helping people deal with COVID. We were able to make donations to Family Focus, the Weaver family over at C&W, with the things that they were doing. So we were able to be very versatile and lend our support. One of the mottos of Kappa Alpha Psi is training for leadership. And that's something that is not just something that we do in college. It continues at all times throughout our lives. And because of that, we know that what you need to do is you need to train the leaders, and you need to give people the information that they need. And so as we were thinking about the things we wanted to accomplish this coming year, and as it became clear to us that COVID was going to be something that was going to be here for a lot longer, and we were going to need to deal with it, we decided to put together a series of discussions, our Black Men's Health series. So this Saturday, the first one will be just talking about COVID and the vaccine. We primarily want to provide a forum for particularly African American men to get their questions answered, to hear from trusted sources. We have 3 doctors lined up to join us in that discussion. One of them is a Dr. Cornelius Rogers, who was actually a Kappa brother of ours who was initiated at Northwestern University. He's an internal medicine doctor. And we have 2 other doctors from Meharry Medical College, an historically Black medical university in Tennessee. So we're trying to do is just bring these people and provide a forum for everyone to be able to ask whatever questions they may have, to get more information, to find out about, well, where are we in this struggle that we're having with COVID and the pandemic. and we're very excited about it. Anyone who wants to join is more than welcome to join. You could go to our Paul W. Kane Foundation Facebook page, and then we'll also, Malika has a flyer that they'll provide you some information that you can go to.
Yes.
So that's the first one, and that's this Saturday. Then, as you can see, in March, we will have a discussion about educating our children during COVID, and we have very qualified, distinguished speakers for that one. Our April discussion will be on mental health, and our May discussion, I'm looking forward to. I'm calling it a little bit tentative, just because unfortunately we don't know where we will be in May. But if everything goes well and we get to May, and May hopefully does not look like today looks, the way we're looking at today outside, we'll be talking about, okay, how do we get back outside and enjoy things with our family? How do we enjoy Evanston, the community? What are the safe things for us to do after spending all this time cramped up? So we hope to bring very valuable information to our community and give people just the resource and the information they need to lead, whether it's leading their family, leading in their church, leading in whatever organizations are important to them.
This is really, really awesome. So one of the things I've learned about fraternities and sororities is that you all are about the community and informing the community. I didn't know you all dealt with teaching the leaders to be leaders, or teaching people to be leaders. That's even better, even better. So that's how your fraternity continues to live on, is through
Yeah, we often say to each other, iron sharpens iron. So, if you so I'm the current president of our foundation, and the president of our chapter is a brother who went to Loyola, and it was initiated through the Theta chapter, Yao Fosu. And I can tell you, he's going to sharpen your iron when you're making your presentations, when you're bringing up ideas about the things that we're going to do. So we try to uplift each other, support each other, and push each other to another level of achievement in whatever we're doing.
So with COVID and the vaccine that's going to, many in our community are very, not trusting of what's happening, and we're scared, and we are dying disproportionately, getting infected and dying, and it's such a tough spot to be in, because especially if you have a family, because you're hearing you have to get this vaccine, then you're hearing all sorts of different perspectives on it, and it's life or death.
Yeah,
it's life or death. So what would you say to the people right now, in terms of seeking this information? Because one, I don't think we're seeking enough information out there.
Yeah. Sometimes I feel like there's too much information. What we don't have enough information from trusted sources, I think, is what a lot of people don't have. Another thing I would say, first and foremost, is we are not crazy for being suspicious.
That's right.
Like, we didn't just wake up one day and decide to be suspicious. The pandemic has pulled the covers back on a lot of discrepancies. They've pulled back on the covers on inequity in terms of access to healthcare, quality of healthcare, quality of diagnosis, treatments, all types of things. So, this just didn't happen with the pandemic. This has been something that's been going on in our community for a long time. So first and foremost, people are not wrong for saying, I just need to know a little bit more. So that's why we're saying, okay, well, here's a little bit more, and you should be very comfortable with the people that are bringing you this information. That's what we're trying, that's what we're trying to do. And like you, I'm concerned that, because I just heard it on the radio the other day on NPR, that said that, of the groups that are most resistant to signing up for the vaccine, African Americans are one of the groups that are most resistant. However, when you say we're most resistant, we're at, I believe when I heard this interview, we're at 60-something% of us are saying we're going to take, I'm definitely going to take the vaccine. So it's not that most of us aren't, but that's too large of a percentage that is saying they won't take it, or they are just very nervous and don't know if they're going to. So like I said, what we're trying to do is bring people information from trusted sources. Like Meharry, you can't find a source that's more trusted in the African American community than the Meharry Medical College. And for Brother Rogers, I mean, there are brothers in our chapter who know him personally, know the quality of his work and how much he cares for his people. So these three people that we have to answer questions and provide information are really top-notch people that anyone that tunes into can listen to. And once again, we want to provide the forum where you can ask any question you want to and feel comfortable about it. You and I talked earlier, and I had a kidney transplant a few years ago, and so I'm on immune suppressant drugs. I'm definitely in the high risk category, but even me, I'm waiting until I hear from my doctor to tell me, okay, you can go take the vaccine. And I think I'm in the next tier of people that are going to get approved, but I'm not proactively seeking it out or anything. And I'm in a position where I have a relationship with my doctor because I see my doctor so often. So I have a trusted source of my own, and other people just don't have that. It's a good thing that they don't have to go to the doctor as often as I do, but still, we know from research and other things that we're hearing about inequality and inequities that a lot of African Americans don't have the same type of relationship with healthcare professionals that other people in our society have. So you're not crazy, you're not wrong. Personally, I'm going to take it as soon as my doctor tells me I can, and I can get an appointment and everything. But yes, you're not a bad person because you are nervous. You're smart. You're smart to be nervous based on the experiences that we've had.
Mm-hmm. And it's smart to seek out as much information about it as you possibly can so that you make that informed decision.
Exactly.
Yeah.
Exactly.
Yes.
Yeah, because I mean, right now I believe there are 3 or 4 different vaccines going around. And just to use myself as an example again, one of the vaccines that, it seems that after the second shot, I've just been looking at my Facebook page, because a lot of my friends are, being very public about, I took the vaccine and I want you to know. And a lot of people are promoting this to their families and friends and saying that they want them to do it. But a lot of people are also saying, well, after I took that second vaccine, I had some flu-like symptoms. I was very sick, I feel better today, but last night was very rough. Well, that's on a healthy person. So I'm sitting here, I'm thinking, okay, well, if my healthy friends are dealing with flu-like symptoms that are giving them a rough night, what does that mean for someone like me who is taking, 20 different pills a day, and I have a serious pre-existing condition, and we know that COVID attacks the kidneys. So, I understand. I can appreciate it. I'm in the same boat in a lot of ways with a lot of people, and I don't, I'm not going to denigrate them for being cautious.
Mm-hmm. Yeah, we're in the same boat. I am very cautious. I did fill out the information to put myself on the list, but I'm in no hurry. They can take as much time as they need before they get to me, because I have asthma and it does attack the lungs too.
Right.
So that's one of my biggest fears, is not being able to breathe. It's a horrible place to be in. And so,
well, yeah, it's a scary situation. So, once again, you and I, we touched base earlier today, and I was telling you, thanks to this wonderful winter wonderland we found ourselves in, my car was stuck in the alley, and I was very fortunate in that my neighbors, a couple of my neighbors, or 3 of my neighbors, came and helped me push my car out. But at one point, while we're pushing the car, I look up, and none of my mask was on my neck, but it was not covering my face. One of the people with me didn't have a mask on at all, and the other guy, his mask was down. And I had to, hey, we need, whoa, we're pushing the car in the snow, breathing heavy, all right next to each other. Like, this is not good. This is not a good situation. So there's just so much you have to be worried about, so much you have to be aware of. Any not even mistake, but you're always at risk of being exposed anytime you have to be out of your home with the people that where exactly where they've been. So, for me, I'm looking forward to taking the vaccine so I don't have those panic moments like I did today. And I need information on, is there one I should be taking versus one that somebody else is taking? Like, if they call me and say, oh, this is the one, I mean, should I step back and say, no, because I heard this other one is working out a little bit better for people with kidney transplants or people that are taking Prograf or anything like that. It's a bigger issue than just go get the vaccine.
Right, right. Well, I'm looking forward to this event because I have a ton of questions, like what you just said. So I was told, so there's Pfizer, and then there's Moderna, and then there's a couple others. So one has the synthetic version of COVID-19 that they inject in you, and then the other has a very small trace of the actual virus that they inject in you. So then I'm like, okay, well, if you're someone like me or you, I got lung issues, you have a kidney transplant. Um, yeah, do you take Moderna? Do you take Pfizer? Do you take the synthetic? Do you take the real? So yeah, ooh, I can't wait to this event because I got a
Yeah,
ton of questions.
right, right, right. And like I said, I think everybody, no one should feel sheepish about the fact that they have questions.
Mhm.
And unfortunately, no one should feel sheepish that they are not trusting. I was talking about this with another friend of mine who isn't African American, and he was asking me why I think, we're so um, why we're so resistant.
Mhm.
And this person actually had heard of the Tuskegee experiment. He said, well, the Tuskegee experiment was years and years ago. And I said, yeah, you know what else would sound crazy? You would probably tell me I was crazy if I told you that a governor was going to do something that would poison a majority Black town's water to the point that all their children had lead poisoning. You
Mhm.
would probably tell me that would never happen. It happened in Flint, Michigan.
Mhm.
And the issues that those people are dealing with today are going to be with those kids for a very, very long time. We don't even know what is going to be the effect of them. So that sounds like just an incident. No, it's a systemic problem that happened based on a decision that someone in a position of power made that affected a bunch of people who had no power and were supposed to be able to trust their water supply.
Mhm.
So no, we are not crazy. We are not overly cautious or being superstitious or whatever. We're just saying we've been through these things before.
Exactly.
You know, we have yeah, as the old folks used to say, a hard head makes for a soft behind.
Mhm.
So so learn from the mistakes, and this is definitely a learning experience for us as well. Hopefully we won't have another pandemic or whatever to go through in our lifetimes, but in case we do, we need to learn from this. We need to be prepared, and we need to gather information from good sources, not from the internet,
Mhm.
um, not from doing Google searches, not from what somebody is posting on Facebook or this, that, and the other. You should be talking to your healthcare professional, or you should be talking to healthcare professionals who are provided to you from a trusted source.
And also, as far as health and the Black community too, just the foods, the restaurants, the fast food that they put into our neighborhoods, that's slowly killing us over the years. I mean, that says something, that speaks to what we're to our fears.
Right,
but
right.
it's in our neighborhood. Um,
Yeah, yeah,
so yeah, I don't understand when people question us, like, why are you so afraid? Like, what, like we're stupid, just some superstitious, spooky people or something. I don't
right,
understand that.
right.
We have
Well,
no.
one thing, just anecdotally, that I have noticed in my career as a financial advisor, and I grew up in a family that I think would be considered working class or maybe even working poor. I don't know how anyone, but one thing I noticed about some of my clients that are a little more well off is when they talk about going to a doctor,
Mhm.
they don't just go to a doctor. Like if I talk to a client that has to have a knee surgery, right?
Mhm.
That client says, I'm going to see Dr. John Smith over at North Shore because he is the best left knee MCL surgeon in the Midwest.
Mhm.
We go to a doctor. Like, I'm going to the doctor. When I got there, this was the doctor they assigned me to. I either had a good interaction with that doctor or I didn't. That doctor either said something that made me feel that we had dialogue or trust, or they didn't.
Mhm.
But that's just a different kind of experience. That's a completely different type of healthcare. So if your experience in healthcare is, I go sit down with the best in this field, best person in their field to operate on my right knee so that it's comfortable when I get back out and go bike riding, versus I got to try to find a way to get in to see a doctor.
Mhm.
That's, just the experiences are different. And we're so stratified as a society that neither side of those, I think, really understand what the experience is like.
Mhm.
And so now we find ourselves in a situation where if all of us aren't okay, none of us are okay.
Right.
So if and that also, when I talk to my friends and they are skeptical, um, that's one of the points I will make, that where I will that leads me to encourage people to be more positive about considering to getting the vaccine.
Mhm.
Is clearly what this has shown is we are definitely all in this together. If the people at Whole Foods bagging your food, if they aren't healthy, you can't be healthy.
Right.
If the people coming to clean, your cleaning service coming to clean your house, if they aren't healthy, you can't be healthy.
Mhm.
We're all in this together. We all need to do whatever it is we have to do to be preventative to the spread of this virus, and to deal and protect ourselves from it in the future. So however we get there, I don't know. I know what I'm going to do, and we just want to make sure that the people in our community, and particularly the African American men in our community, have an opportunity to get the information they need so they can go be advocates to their friends or do what they have to do, feel they have to do to take care of their families.
What do you think of? I was talking to someone who's on a board of a hospital, and he was saying in some communities, some areas in the country, they're actually putting bands together and driving to the Black and Brown communities and giving them that education as well as vaccines. So they're actually
That
taking it to them.
Yeah, that sounds like an excellent idea to me. I'll tell you something that I heard the other day. Um, so the hospital, the primary hospital in the community where I grew up, had a bad reputation when I was growing up, still has a bad reputation today. And because of that bad reputation, a lot of people are not going to the hospital. So it's people from outside of the community uh, coming to get, coming to get that vaccine at that hospital. The types and levels and quality of the luxury vehicles pulling up to that hospital today is quite different than what has ever been in that parking lot before. So yeah, we need to do a little bit more, and not complain about having to do more. I mean, we have to do more for a reason.
Mhm.
People did not start distrusting that hospital in that community when the pandemic started. People in my community did not trust that hospital when I was a child.
Mm.
and they still don't today. So yeah, no, they're not, they are not wrong. They are not wrong at all. If people need to, you got to bring the message to them, because once again, we are all in this together. One infected person on a bus, one infected person on a subway, one infected person on a metro, whatever, can damage a lot of families. So we have to do whatever it is we have to do. We can do it to get people educated and comfortable, and get them to acknowledge that we have to do to protect themselves and protect each other.
And so the series, break down the series again. So I know we talked about at the beginning, but I know some people probably got on the live.
Yeah. So this Saturday, our discussion will be on the state of COVID. Where are we? And also a discussion about the vaccine. And like I said, we're going to provide a lot of opportunity for people to ask questions. That's 10 o'clock this Saturday. And we're slated to go till 11:30 if we have enough questions for that time. Then in March, our discussion will be on educating our children during COVID. I'm on the board of YOU here in Evanston, and so I understand the struggles of, well, how do we take care of the children? How do we get them in the classroom? How do we get them, especially for the ones where they don't have the Wi-Fi access or the proper laptop or just the right environment at home for learning? How do we take care of them, and how do we take care of the teachers? No one signed up to be a teacher. Like, these aren't infantrymen in the military, in the Marines. They didn't sign up to be in a life-threatening situation. But just want to talk to people about what are we seeing? What's the effect of having to learn like this on our students? And what are the things necessary to bring them along? Then in April, the discussion, and that's going to be with a psychologist, Dr. Charles Alexander, who is also a fraternity brother of ours, just discussion about mental health in this. We are effectively, almost up on a year from being aware, well, definitely a year of being some awareness. But I know the last event I went to was March 7th of last year. I helped MC the benefit for YOU last year. And, we were at the Evanston Golf Club, which is in Skokie, probably 300 something people in a very close room. And, one thing that's funny is I made a joke about COVID at that, right? When I got up to speak on the microphone, I had pulled out, I pulled out a bag. I had a mask, I had gloves, I wiped everything down, I sprayed Lysol. At that point, it was funny. We had heard about it. We knew it was out there, but we still had a packed house in a small room. So, we've been in this situation for a very long time. I know personally, late in the fall, I was thinking, okay, maybe by the springtime, I will be able to travel. Maybe I'll be able to take a vacation by April, May. And by January, I could tell that wasn't going to happen. So how do I take care of that was sustaining me. That was sustaining me. That was kind of getting me through. I'm like, okay, I can get through tax season, which is a rough time in my business, a very busy time. I can get through tax season. Then after tax season, I'm going to go ahead and take this vacation and go somewhere and relax. Well, that's not happening. So how do you keep going? What are you dealing with? What's your coping style? I haven't been able to go to the gym, and that's a whole, that used to be one of the things I did to relieve my stress. So we want to have a forum to talk about, all right, how are you doing? How do you know how you're doing? How do you know that, how do you check in? How do you check in on yourself? How do you make sure you're okay? How do you know how your family is doing? What all do you all need there? And then, so that's April. And then for May, like I said, we're hoping to talk about how do you get back outside? I think if we can get to May and the pace of people taking the vaccine or the levels of the spread have fallen, then we can start thinking about getting back outside. But, it will have been over a year since most of us had really been outside, really trying to enjoy our environment. So that's what we're hoping it will be the topic. And, we think we have a good series of discussions. And we're also going to be leading into one of our fundraisers for the Paul W. Kane Foundation. We used to do a bike-a-thon. We used to call it Cycle for Your Heart, that we would do every year in September, I believe first week in September or late August, one of the two. But we're going to, we want to time that for when hopefully we can be back outside and we can figure out some way of getting outside and enjoying ourselves. So we have a pretty full calendar, at least for the first half of the year. And we just want to do what we can to help our community, because that's what we're tasked to do. We can't ever, as members of our organization, we can't ever forget that we are here to serve a community. We believe in servant leadership, we believe in achieving, and we believe in training for leadership.
I know I gotta let you go shortly, but I got one more question, maybe two.
Okay.
One more. So here in Evanston, I don't know if you've been hearing about District 65, because I was looking on the flyer and we're talking about educating, how do you talk to kids about COVID, educating them about COVID. So, I don't know, have you heard about a lot of the heat that D65 is under, the board is under?
Yeah, I know a little bit, just because I'm involved over at YLU.
Mm-hmm.
And, I need to hear that session just as much as anybody else, because I don't have children. I'm the uncle and godfather. So I'm the one that will feed your kids. They can do all the dumb stuff with me. We're going to have all the dumb fun. Right. But in September, I was talking to a fraternity brother of mine who lives in St. Louis. He's principal of a school there. And at the time I was saying to him, if I had kids, I think I would just be trying to homeschool them for right now. I think that's what I would do. And he said to me, well, yeah, that makes sense for someone at your income level, someone, assuming I had a kid and was married, someone at your education level and your spouse's education level, that probably makes sense for you to be leading like that. He says, but I know I have kids who don't have the proper internet access. I know I have kids who don't have the proper laptop. I know I have children where the two healthiest meals they eat every day are at my school. I know I have children that are at home in environments that are not particularly safe. So when he told me that, and then I really sat back and thought about it, it just brought a completely different perspective to me, because I hadn't been thinking about those kids. And to be even a little more personal, when I reflect on my years, especially my high school years, part of the reason I'm an early riser and part of the reason I'm just accustomed to be involved in everything is that's what I did in high school, just because I wanted to be out of the house. I was out of the house, and I was out of the house being involved. And, if you look at the yearbook, the list of organizations I belong to next to my name in yearbook is like this long, because I'm like, I want to be out of the house. I want to be busy. I want to be doing something. So, having to think about it in that way, that's completely different. But then on the other side of that, and this is some of the things that I've gotten from just talking to people at YLU, it's like, okay, but what do we do about the staff? Like, we can't, how do we make sure we're not endangering the staff? I understand that these kids are out of school. I mean, anyone that's been involved in education in any way knows that we have to worry about what kids lose just over summer vacation. Mm-hmm. So, we're bringing Reuben Howard from Oakland Community College, Craig Lynch from YLU, and Corey Winchester, who's a teacher at Evanston Township High School, once again, to give the people information about, this is what your children are experiencing. This is what our learnings are. This is what they may be losing, and this is where they might be thriving. Some of this might be good for some kids, but we want to, once again, give people information from trusted sources, from experts, people who can give us bona fide ideas about what we should be doing as a community for the children.
Mm-hmm. I was with you in terms of supporting D65, the board, and them trying to keep the school closed as long as they could until they got more information because they didn't want to risk just, losing just one child or
Right.
one staff member. So it was such a tough position for that board to be. I couldn't. The pressure that they were under. I mean, they were actually receiving death threats and everything, because they were parents who were saying, my kid is threatening to kill himself if he can't
Right.
go to
Right.
school. And some of us can't really relate to that. And then, like you said, you have to put yourself in those people's shoes who have kids who got emotional issues like that. So, it's been really interesting. And I know the board actually offered services for
Hmm.
those families that had kids with serious emotional issues that weren't handling the quarantine
Yeah.
well. And
Yeah. I think we all need a lot more information and a little more grace from each other.
mhm.
And I think you know, we all need to understand we're all a little bit more of a time bomb than we were a year ago. You know, so maybe right. So maybe somebody who probably would have let you, cut in front of them when they're driving this year might be that person that's giving you the finger. or or maybe that person where you have an altercation over your parking spot today, that becomes a fight because everybody's a little more stressed out.
Mhm, mhm,
And and that's what we wanted to acknowledge. Like, okay, this is where we are.
mhm.
We are here. You really can't opt out of this situation. So we just want to give you what you need to protect yourself, protect your family, and take care of yourselves because this is tough, and we shouldn't pretend. And that's one of the big things. I mean, partially why we are specifically trying to speak to men is we want people to know that it's okay. Like, we understand you are stressed out. You don't have all the answers. You
Right.
don't know exactly what you should. That is okay.
Mhm,
You know, we
mhm.
haven't had a pandemic like this since 1918. None of us were, none
Right.
of us were adults learning how to handle this.
Mm-mm.
So we all need the support and we all need the help.
Mhm. And getting access to the resources to help families that have kids with emotional issues or to help yourself in dealing
Right.
with it as well and staying healthy. I think everybody's put on maybe 30 pounds.
Yeah, yeah.
It's been a
My my COVID, yeah, my closet's starting to look like I'm at Joseph A. Banks. I got suits in different sizes, you know, pre-COVID, during COVID. It's and I don't know about anybody else, but I made the dumb decision. I like to cook, but then I decided to learn how to bake now. Like, that doesn't make any sense, but that's what I came up with because our COVID bubble is about 3 people, so it's me, my girlfriend, and whomever else I can find to feed the rest of this key lime pie or whatever I made. I don't know why I did that, but you know, we're all we're all just trying. I think we're all just trying to get through and keep our sanity and care for the people that we love.
Yes, yes. I made 3 blueberry pies from scratch. So
There you go. See, so that's the other thing. I think we're going to have to worry about getting fatter even after COVID because every friend you have that can cook has been working on something. Like the potlucks going to be off the chain when this is over because everybody has been perfecting some dish. Whenever we can get back to having those, that's going to be a good time.
yes, yes. All right, Kevin. It's always a pleasure.
It is always so good to see you.
Yes.
And thank you so much for providing this forum. Thank you so much for having the vision to provide this forum because I remember when you first started it, and I remember when you were first doing it, and I'm so happy for you. I'm so happy that you're doing it, and I appreciate everything you do in the spirit with it that you bring to it. So thank you so much.
Thank you. Thank you for all that you do. Everything. Just working at Edward Jones, providing that financial literacy, advising people, which I need to talk to you definitely. Kappa Alpha Psi, you guys are always busy and showing leadership in the community, making things happen for people. So thank you on that end as well.
Yo,
And is that one of you? Yep, Dale.
Yeah, yeah.
and the Paul W. Kane Foundation. Thank you so much for doing this, because we are in a time period we need to be gathering as much information as we possibly
Yeah,
can.
we can.
Because it's
We do.
life or death. Mhm.
You are definitely correct. And the 10 men who founded our organization left us a pretty high bar
Mhm.
that we have to live up. Pretty high bar, pretty high standard that we have to live up to. And we are just kind of stumbling along our way to try to be half the men that they were.
Mhm. I think you all are doing a great job. So thank you again, Kevin. Thank you. Thank you.
All right. Thank you. You have a good evening. Take care. And oh, well, you're already home comfortable. So enjoy that. I gotta figure out how I'm getting in my house.
You get home safe. Get home
All right.
safe, please. All right.
All right. You take care.
Okay. Thank you.
Thank you.
All right. This is Malika, Evanston Live TV. That was Kevin Mott. You all, please be sure I'll put all the information in the description so that you can attend that event, the Paul W. Kane Foundation. Let's get as much information as we possibly can. I truly understand about being afraid of the vaccine. I'm with you, but let's gather as much information as we can, because it is life or death. And let's make an informed decision about how to deal with this with our families and everything. So, you all, please stay tuned. We have more amazing guests doing amazing things right here in Evanston.